Green ICU Initiative is really how we can provide the best quality of care without impacting the future of the healthcare. This is really about how we're going to provide sustainable healthcare, safer, better healthcare, better quality care to our patients. And this is our journey for the last few years. We started our Green ICU Initiative 3 years ago. There is a lot of work initially that was done in New Zealand and Australia, not really much work done in the United States. However, United States healthcare is the 13th largest producing greenhouse impact. When we looked around the country, nothing much was done.
At Houston Methodist, we have a lot of things that are in the works currently, and also a lot of things planned for the future. We really started with our emissions baseline, determining what is our carbon footprint, and utilizing that to audit our data, make sure that we're reporting correctly, and then next steps we'll look to determine what is the cost abatement. So what if we want to get to net zero, what is it going to cost over the next 20, 30 years to achieve that, so we can start planning and getting the support from our leaders. We've also instituted a medical PVC recycling program, and this is unique in its kind. There are multiple pilots here in the US. We've modeled ours after the Canada Vinyl Institute, but ours is more specifically aimed at being financially viable. We want to make sure that it has an automated system to make it viable for the processor and also for us. And so the difference there is in how we're collecting, how we're aggregating across the system, and how we're transporting that to the end markets. We're really excited about that because it's a foundation for a larger recycling program. And so we've partnered with Healthcare Plastic Recycling Council and Alliance to End Plastic Waste to run a Houston pilot. And that Houston pilot is really looking at recycling infrastructure, what's in place today, what are the barriers, and how do we develop a playbook to be able to launch an advanced recycling in healthcare for the Houston region.
So we look at the amount of unnecessary supplies used, look at medication delivery methods, looking at the supply chain of where we source our supplies from, and again, how they're disposed. So looking at reduction of waste, appropriate waste disposal and recycling. All these are different avenues that we go down to see how we can reduce our impact on the environment. And that's just to name a few. There are many, many different ways that our team can help reduce our impact.
And that's the focus of Houston Methodist. The patient is at the center of everything we do. And quality and safety are so important in day-to-day for our clinicians, our employees. We really focus on that. So when we do this right, it's not impacting patient quality and safety. But when you look at the continuum, and especially from their departure from the hospital and they go home, how is it impacting the community? How is the waste and the operations impacting our environment, our wastewater, our water streams? That's where we really look to see the bigger impact, and to invite other industries, not just healthcare, to participate. And when we see that, we'll see a reduction in certain health outcomes that helps healthcare in general become more sustainable. How do we make sure that we're not over inundating our hospital beds and our emergency rooms by taking care of our patients? It's really preventative medicine in action.
And impact is because healthcare also significantly contributes to the whole environment, impactful in terms of climate change and sustainability. ICUs are one of the most heavily resource impacted areas in the hospital. They produce greenhouse impact 3 times than anywhere else in the hospital. So we have to be better custodian to provide care without harming the environment, be better cost conscious, and yet in the paramount deliver world-class quality care.